Well, let's now focus on the U.S., where coronavirus cases and hospitalizations are at a 6-month high, fueled by the rapid spread of the Delta variant across the country. Grappling with low vaccination rates, nationwide COVID cases have averaged 100,000 for 3 days in a row. And now the surge of the disease is the strongest in some of the southern states. Hospitalizations also rose 40%, and deaths have registered an 18% uptick in the past week. Well, to talk more about the situation in the United States, we're joined by Professor Ishita Dwivedi, Cardiology, Lenox Hill Hospital, New York. Thank you so much, Doctor, for joining us in a very, very worrying situation in the U.S. Initially, when the vaccination drive started, the numbers seemed promising, but now you have over 100,000 cases being reported every day.
Yes, unfortunately, we are seeing a rise in the numbers. The hospitalizations have gone up by about 100% in the last few weeks. Having said that, I think it's mostly related to the Delta variant. We're seeing that most of the infections currently are related to the Delta variant and are occurring in the unvaccinated population. Having said that, about 30% of the eligible United States population still remains unvaccinated. And what we're seeing is that is mainly the cause for the increased cases, hospitalizations, and death in the United States currently.
And this surge in infections, now that you've had a chance to study it, what has it taught us about breakthrough cases, that's infections after you've been fully vaccinated?
Breakthrough vaccinations are not a surprise because the main effect of the vaccine is to prevent deadly hospitalizations, deaths, or deadly disease. What we're seeing is that the mortality rate or the rate of death in vaccinated people is less than 0.01%. But breakthrough infections are taking place in people who are vaccinated, but most of the symptoms are mild. Hospitalizations are uncommon, and it's mostly in people above the age of 65 years. So we remain hopeful that as we get more population vaccinated, the breakthrough infections and the overall hospitalization and the case rate will go down, because the virus will have less people to infect and less means to propagate through the community.
Right. And Doctor, there's such extreme levels of vaccine hesitancy, however, that's being seen in the United States. How are you countering, the misinformation that seems so widespread?
You're right. Absolutely. With the internet and, information available to everyone at our fingertips these days all over the world, there's misinformation, and that definitely leads to vaccine hesitancy. Having said that, there are mandates being put by the government. So recently, the military troops in the United States are going to be vaccinated, and I believe it's going to be mandated. A lot of healthcare organizations are mandating vaccines for their workers, or requiring weekly testing of COVID-19 by the workers who are employed by these large healthcare groups. So, the hope is that with the regulations put in place and mandates put in place and incentivizing people to get vaccines, there's places that are incentivizing people either monetarily or through other perks and privileges to get vaccinated, and hopefully that should help with increasing the vaccination rates and decreasing the vaccine hesitancy as well.
Now, talking about masks, the mask mandate has been confusing. Earlier, the CDC said it wasn't needed for the vaccinated and people removed it. There was some amount of criticism, and now they're trying to bring it back, but there's pushback against it.
Yeah, unfortunately, with the pandemic, I think we've had to evolve as the disease has progressed, as the new variants have come about. I think in the summer, the hospitalizations and the death rate was at an all-time low, and CDC felt confident to perhaps get rid of some of the mask mandates, but I think nobody could have really predicted the Delta variant and how contagious it was and how deadly it would have been throughout the world. So I think in the light of new information, CDC had to place the mask mandates back, especially in areas of high transmission and areas where the vaccination rates are low. So that's what we're currently seeing right now, and I'm hoping that as more people get vaccinated, we can try to get rid of some of these mandates in the long term, but that remains to be seen.
And what is the thought on booster doses of the vaccine? Of course, there are countries around the world that haven't even got, one dose, but what is being thought there in the US currently?
So that remains to be seen. I think that booster dose is definitely something the CDC is considering very seriously. And come fall, as we start to see the flu season come back again and people are more indoors, I think it'll be under strong consideration to consider a booster dose for people, especially above a certain age and those of immunocompromised status, whether it be because you're undergoing treatment for cancer or other problems that lend your immune system to be weaker than a normal person's. But I think we need more data, we need more science, and as we see that the pandemic evolve, we'll sort of also understand how the variants are evolving and whether, given the new data in the fall, if we need a booster dose for the whole population or a subset of population that are more vulnerable.
All right. Thank you so much, Professor Ishita Dwivedi, for joining us on the program.